Hello everyone, Don Sweet here. I wanted to do a little bit of a different one today and talk a bit about COVID rates, but specifically I wanted to talk about the confusion around the reporting of COVID. I don't understand how we're this far into the pandemic and yet we still have questions around reporting that don't seem clear. So the first thing I wanted to talk about is just where we're at right now. So a lot of times you'll hear the number batted around that we're about 400 COVID deaths a day, which comes from this statistic right here. So let's shrink this guy down to, let's do like the last 6 months. So here we are. Let's see. This goes only to September 28th. So we'll go to April 28th. And in the last 6 months, you can see, we're hovering right around this 400 line. So, a little above, a little below, but, the peak here was 500 a day. But then we've got, valleys on either side. And that red line represents the 7-day moving average. So that's where we're at currently with the COVID pandemic, just to let you know. Okay, so now that we have that baseline, the question is whether or not they're including influenza and pneumonia in those 400 or whether or not that's a separate report. So if we look at here, they talk about including pneumonia and influenza because COVID-19 cases may be misclassified as pneumonia or influenza, okay, in the absence of a positive test result. So, as long as they've got a positive test result for COVID, then they won't include them, right? All right. But they also might include influenza and pneumonia as a comorbidity. Okay, that makes sense. But then lastly, it says the COVID-19 symptoms can be similar to influenza, and so deaths may be misclassified as influenza. All right, so increases in pneumonia and influenza deaths may be an indicator of excess COVID-19 related mortality. So what it seems like they're saying here is, well, we don't really trust that when someone just has a respiratory illness that it's going to be classified correctly. And so we're going to gather these all in one bucket and count them together. That's what it sounds like to me. Now, again, I could be misreading this. It's a little unclear. So we're going to dig in a little bit more into the data, but it sounds like they're including influenza and pneumonia all together with COVID-19 in their reports. All right, so now let's check out the comorbidities. So in this section, they show the comorbidities. And again, when you see these stars, this is just me flagging a section to say that it's important so that I can see it. It also helps me scroll to it really quickly. So here, sure enough, we can see that influenza and pneumonia are listed as comorbidities. If we sort by comorbidities, we can see that influenza and pneumonia are the number one comorbidities. So of all the COVID deaths, about half of them have actually had influenza and pneumonia. Now, that doesn't necessarily mean that half of the deaths were attributable to influenza and pneumonia. Those things are not mutually exclusive. They can have them all, right? It's a little confusing that influenza and pneumonia are lumped together in the first place. Because, again, these are two different things. We can test for influenza, and we could disambiguate this so that it wasn't confusing. But right now, as it stands, it is unclear. I mean, it could be literally almost half of these deaths could be potentially attributable to different causes. Because we're not testing for COVID all the time. We're not testing for influenza all the time. We're not, and then pneumonia is just a diagnosis based on symptoms. But what we have here is just confusion, and I think that it could be clarified if we would state in our reports exactly how we were doing it. Are we digging in? Are we showing these things separately? Now, part of me suspects that we are not showing these things separately, and we can tell this because of the baseline. So if we look at the baseline, so this is, they call it PIC, and that just stands for pneumonia, influenza, and COVID altogether. So if we scroll down here, we can see that the baseline before COVID, so there's no COVID deaths here, right? So COVID starts here. This is where the pandemic starts. But before then, you do see that we have influenza deaths, okay? And then this is just all of the deaths due to these three causes, pneumonia, influenza, and COVID. But it's percentage. So of all the deaths that are going on right now, what percentage of them would you assume are, pneumonia and influenza early on before COVID exists? And you can see the baseline. This is just pneumonia and influenza. So each year, we hover around, the 7% line for how many mortalities are attributable to pneumonia and influenza. Now, there are times that it spikes. This one, looks closer to 11%, right? All right. And then this seasonal baseline and epidemic threshold. I'm not sure the epidemic threshold is really something they are concerned with, but the baseline is important. So this is the baseline of what we expect, and you can see that year over year it tends to follow that unless we have a crazy spike of influenza like we did in 2017. All right, obviously, as 2019 starts all the way through the pandemic, you can see this blue percentage. This is COVID deaths, right? And obviously it's spiking really high. But you'll see that the red line is the number of influenza, pneumonia, and COVID deaths together, and they are virtually the same, right? Whereas here, there's a bit more of a disparity between the two, and about the same percentage disparity that would be over here. So about 6% disparity is right here, right? That's about what we'd expect. Here, it's maybe 8%. That seems a little more accurate. Here at the spike, it looks like we were just attributing everything to COVID. Now, it is possible that COVID was outcompeting everything else, and then that is why they're virtually identical, because pneumonia and influenza were just being boxed out completely. But given that about half of all COVID cases have pneumonia or influenza listed as a comorbidity, that seems unlikely, right? Again, we see more of a disparity. That seems more accurate. As long as these two lines aren't really close together, that seems more accurate. So now that we get to here, we can see that we are returning to close to this spike over here. Now, this spike of influenza has essentially been replaced by this spike of COVID, right? So when we talk about the daily death rate, it's important to realize that this is what we're talking about, and that the baseline of pneumonia, influenza, and COVID has gone up drastically during the pandemic, but now is coming back down. I'm not going to say it's the same, right? We're still definitely above the seasonal baseline. We would expect this to be, a few percentage lower for sure. So we're still not, out of the woods. But it has come down drastically. It is approaching the baseline, but it is still confusing as to whether or not these deaths, compared to these deaths, are including influenza and pneumonia as part of the whole. And it seems like they are. That's what the comorbidities report and this report seem to indicate to me. All right, and then lastly, we just have a coding issue, because we could fix this in an instant if we just said, hey, we're going to code things separately. We're going to say, hey, this is suspected COVID, this is confirmed COVID. And the World Health Organization, the WHO, has actually made a code for this. So when you see the code U07.1 in most of the world, what this means is confirmed COVID case. We know that this is COVID for sure. And so then any comorbidities are in addition to that. Now, it can still be confusing whether you mean that COVID is the primary sickness or just a contributing factor. That can still get tricky worldwide. But here in America, we use U07.1 for all COVID cases, and I don't understand why. So the WHO provided a second code, which is this U07.2, for clinical or epidemiological diagnosis of COVID-19 where a laboratory confirmation is inconclusive or not available. Inconclusive, this means that they literally administered a test. There was some result, but it was too low to really count it, right? And so really, almost all of ours should be using U07.2 because we say this right here. So because laboratory tests results are not typically reported on death certificates in the United States, NCHS did not implement U07.2 for mortality statistics. So we're not even using this code ever. That is adding to the confusion greatly. That's why we can't tell whether or not these deaths are COVID deaths, pneumonia deaths, or influenza deaths. It is simply unclear. And there's no reason for it to be unclear other than keeping us in the dark. I get that you say, well, we can't give a test to everybody. Fine. We'll use the code that says you didn't give a test to them. That's just fine. But we have to keep the data clear, because if not, we lump things together and then we draw false correlations. We have to understand the data. Again, I'm not calling for any drastic change. I'm just saying, tell us what it is that you've observed. This is one of those things where people talk about, lies, damn lies, and statistics, right? Statistics get worse and worse the more you lump things together. I've done a lot of data analysis in my career, and some of the worst data isn't a lack of data, but an abundance of data where things have been lumped together so you can't slice it down by anything, right? If you can't slice it down by age, or you can't slice it down by the exact causes, then the data is effectively meaningless. And this is where we're falling into. We are failing to learn what we need to learn from this pandemic because we are not reporting data accurately. If we would just start to use this code, maybe the data would be a little more clear. But at a minimum, at least we could ingest the data from the CDC and understand it better, because it would be clear what they are talking about. All right. This is a little different one. I'll get back to talking about authoritarian governments here shortly, but I hope you enjoyed. Stay free, my friends.